One thing that I've noticed over the years of being a clinician is that sometimes it just doesn't work. Coming and seeing a doctor one-on-one isn't enough to get people to their blood pressure goals or any of their lifestyle goals.
I saw a need for trying to improve hypertension control in the community, particularly in a community of African Americans, where the prevalence of uncontrolled hypertension is very high. And looking around at the community, Dr. Tully seemed to be an excellent person to develop a partnership with.
So with working with other community members, and Ted Kotchen, who is part of this project, came and approached us wanting a partner, a community partner between MemCW and Progressive, to look for ways to do a group project among high-risk folks in the African American community to really try some more innovative methods to get the blood pressure under control. And so that's the genesis of this.
Well, I have hypertension, and someone in my doctor or Dr. Telly mentioned they were going to start up some kind of little program to discuss ways to prevent or work on reducing the hypertension. So mainly that's how I got involved through the clinic here.
So with the hypertensive idea in place and support from our board, we then moved forward with writing a HWPP Healthier Wisconsin grant for submission that would include a group setting for patients to see if this was a functional way to help engage them in their own medical care.
Well, our main innovations come in two ways. One is at the program level, which is utilizing a community advisory committee. So we have members of the greater community who are also interested in public health. We have the American Heart Association, we have the health education, we have the Center for Population Health all represented. So folks who've done these kind of community programs in the past to help us kind of get off the ground running.
For anyone else who's looking at starting this program, I think my biggest suggestion is make sure that you have a multidisciplinary team. We all work together, whether it's the nurse, the MA, the docs, or myself, so that you have those multifaceted opinions, experiences, and education to kind of coordinate things. And just make sure that you have someone who can really connect with the patients. I think patient connection is the most important thing, and that weekly phone call, whether it was me or the community health care worker, really is an important piece to getting those patients tied into the project.
We started with the Simple 7 from the American Heart Association, but 5 years from now we may have, several different topics, or similar topics but a different slant on each one, reflecting what the community has told us that their needs are. So that, I think, is really exciting, and that keeps me interested in doing and continuing to reinvent it.
Been very beneficial. Like I said, I lowered my blood pressure considerably by knowing certain foods to eat and certain foods not to eat. I stay away from a lot of canned foods and buy fresh vegetables. I eat a lot of fruit, and like I said, I do my little exercise, and boil, bake, very little fried. So yes, I recommend it to anyone that has hypertension or just want to try to control their body weight, cholesterol, all these things that come into play. So yes, I would recommend it.